They said drugs would make you cool, but they lied. Find out the truth about drugs. Drugs are everywhere. Nearly everybody knows somebody who has used or uses drugs, whether the user is a friend or a celebrity. Since drugs are everywhere, so are the effects of drugs. While drugs affect everyone around them, some of the effects that drugs have on a user include becoming antisocial, losing sight of goals, being content with less, transforming into a different person, and gambling with health.
How drug works. Drugs are chemicals or substances that change the way our bodies work. Some are medicines that help people when doctors prescribe them. Many have no medical use or benefits when taken, usually by swallowing, inhaling, or injecting. Abused drugs find their way into the bloodstream. From there, they move the brain and other parts of the body. In the brain, drugs may intensify or dull the senses, change how alert or sleepy people feel, and sometimes decrease physical pain. Because of the way these drugs work on the brain, they affect the ability to make healthy choices and decisions. Even drinking makes people more likely to get involved in dangerous situations like driving under the influence or having unprotected sex. Although substances can feel good at first, they can do a lot to harm from the body and brain. Drinking alcohol, smoking or using tobacco, taking illegal drugs, even sleeping do all damage the human body.
Why do people use drugs? Different people use different drugs for different reasons. There are of course legal drugs we all come across every day. For example, you may take medicine when you are sick, alcohol to help you relax, or coffee to help you stay awake. What we are referring to here is illegal drugs. You may experiment with illegal drugs because of curiosity, because your friends are doing it, or to escape boredom or worries. You may take certain drugs to change how you feel. You may believe it's fun or fashionable thing to do. You may continue to use a drug because you enjoy it, or because it's part of your social life or culture. This is often called recreational drug use. Sometimes drug use can become an important part of your life. This may be because of emotional, physiological, or social problems you are experiencing. Some drugs can make you addicted or dependent, where you lose control over your drug use and feel you cannot function without the drug. Some people use more than one drug at the same time. This is known as polydrug use. Mixing drugs can be dangerous because the effects and side effects are added together. This includes mixing illegal drugs with legal drugs, such as alcohol or medication. For example, drinking alcohol and taking cocaine increases your risk of irregular heart rhythms, heart attacks, and even death.
So, what are the common abuse drugs? The first one is alcohol. Many people drink alcohol in moderation without experiencing problems. They know their limit and stop when they've had enough. They drink in a safe environment at a social appropriate times when it will not get in the way of work or personal obligations. Moderate alcohol consumption is not considered to be alcohol abuse. The trouble starts when alcohol use interferes with an individual's ability to live a normal life. Alcohol abuse is essentially defined as a drinking too much and too often. This can be difficult to measure as alcohol affects people differently depending on their body mass index, age, tolerance, level, and gender. Generally, moderate drinking is 2 drinks a day for men and 1 drink a day for women. A single drink is 5 ounces of wine, beer, or 1.5 ounces of liquor. Anything over this amount may impair someone's judgment, memory, and coordination to the extent that they cannot perform tasks like making responsible decisions, working, or driving. The second is amphetamine. Amphetamine is abused in a number of ways. Of course, it is possible just to take the pills and experience a mild high that way. However, some people crush the pills and snort them, creating a faster, stronger high. One of the quickest way to get high from amphetamine or methamphetamine is to dissolve the powder in water and inject it. This method gets the drug into the bloodstream and to the brain almost immediately, creating an intense high. Students often abuse amphetamine through off-label use as a study aid. These individuals consider that the high energy and focus that result from the drug can help them perform better on tests and in school. However, an article from Time discussed a study that showed students who use amphetamines do not perform. In fact, they often perform worse. Nevertheless, the drug does make people like they can focus more, do better, even if the opposite is the truth. More significantly, this level of abuse can lead to more severe, illicit use of the drug to get high. Third one is cocaine. Cocaine is a drug made from the leaves of the coca plant native to South America. Cocaine affects the neuropathways in your brain, leading you to feel talkative, energetic, and euphoric. Addiction to cocaine can develop quickly, even after trying it only a few times. An addiction can be physical, meaning your body craves the drug. It can also be mental, meaning you strongly desire the drug's effects. Cocaine can be consumed in a variety of ways. It can be inhaled through the nose or injected into a vein, and it can be used via genital or rectal routes. It can also be smoked after being processed into a form called crack cocaine. Addiction can occur quickly from any of these methods. Cocaine can also minimize your desire for sleep and food. Some people report that cocaine helps them think and perform tasks more quickly. Many users begin to crave the feelings that cocaine creates. Frequent use of cocaine can cause you to develop a higher tolerance to the drug. A high tolerance means it takes more cocaine for you to feel its effects. This may lead to using greater amounts of it, which can impact your mental and physical health. So for the next one is marijuana. Marijuana produces several symptoms in your body and also in mind. Symptoms can vary from person to person based on their genetics. Other factors that come into play are the marijuana's strength, as well as how you take it. Your previous experiences using marijuana can also affect your reaction to the drug. Some symptoms are temporary, but many can last longer. Long-term symptoms may lead to physical and mental complications. Symptoms of marijuana abuse can occur in both occasional and chronic uses of the drug.
What are inhalants? Inhalants are chemicals found in certain household and workplace products that produce chemical vapors. These vapors can be inhaled to induce mild altering effects. Inhaled substances are rapidly absorbed into the brain to produce a quick high. Chronic abuse of inhalants can result in irreversible side effects such as coma and even death. Where are inhalant products found? There are more than 1,000 commonly used household and workplace products that can be abused as inhalants. Inhalants are convenient, inexpensive, easy to hide, and legal. There are four general categories of inhalants: volatile solvents, aerosols, gases, and nitrates. Volatile solvents. Volatile solvents are liquids that vaporize at room temperature. They are used for household and industrial purposes. Examples of volatile solvents are paint thinners, paint removers, degreasers, gasoline, rubber cement, lighter fluid, glues, nail polish removers, dry cleaning fluids, correction fluids, felt tip markers. Meth. The extreme physiological and physical toll that meth takes on the body makes it one of the most dangerous drugs on the market. Meth deeply affects both a user's brain and body, and these symptoms or warning signs are visible in the variety ways. One of the first symptoms of meth abuse is suddenly loss of interest in areas of life that were once important to the person. Hobbies, relationship, and career goals will all begin to take a back seat to getting and using meth. Initially, many people will attempt to hide their drug use, but the longer someone uses meth, the more prominent it becomes in their lives. Methamphetamine chemically alters how a user thinks and feels, what can make what was once a recreational drug activity a major life priority. People abusing or addicted to meth will exhibit a variety of behavioral and physical symptoms. Some of the most commonly signs of meth use include hyperactivity, twitching facial tics, jerky movements, paranoia, dilated pupils, noticeable and sudden weight loss, skin sores, rapid eye movement, reduced appetite, agitation, burn particularly on the lips or fingers, erratic sleeping patterns, rotting teeth, outbursts of mood swings, and extreme weight loss.
Ecstasy. Affect and abuse ecstasy and Molly promote the feelings of well-being, happiness, and friendliness. These drugs enhance the user's senses of sight, sounds, smell, and touch. Ecstasy and Molly are common at the dance club and reves. Allow the user to take advantage of their highness sensation. The effect of ecstasy use include euphoria, heightened senses, calmness and relaxation, long-lasting energy, empathy for others, lowered inhibition.
Like most drugs, ecstasy and Molly interference with the brain's pleasure center and natural levels of dopamine. The high from ecstasy generally lasts between 3 and 5 hours, depending on a number of factors including body weight, gender, amount taken, and method of administration. Ecstasy effect can last up to 8 hours. LSD. LSD is known for its profound changes in consciousness and perception. During a trip, users experience a wide variety of effects, most often visual and other sensory. distortion change to true processes, intense emotion, and for some people, surprising new insight in life. Revelation LSD effect typically lasts around 8 to 10 hours, with peak effect occurring 4 to 6 hours after injection. Sensory enhancement, delusion, sweating, alienation, dry mouth, hallucination, tremors, distortion, anxiety, panic attack, flashback, depression. Tolerance to LSD develops quickly if as a specific doses is taken every day for 3 consecutive days. No reaction will occur by the third day. Users who abuse the drugs regularly most take progressively higher doses to achieve the same state of intoxication that they have previously experienced.
So, how to ask for help when it comes to drug addiction? If you think you or a friend may be addicted to drugs, talk to a parent, your doctor, school counselor, or nurse. They can help you get the help you need. Several kinds of treatments are available for drug addiction. The two main types are behavioral, helping a person change behaviors, and pharmacological, which treating a person by using medicine. Experts in drug treatment teach people how to live without drugs, dealing with cravings, avoiding situations that could lead to drug use, and preventing and handling relapses. It can be hard to overcome drug addiction without professional help and also treatment. It takes time and isn't something that can be done alone, that everyone needs.